How important is it to involve family members and carers in therapy sessions, would you say, Elizabeth?
Oh, it's everything. It's hugely important. I think it offers families a meaningful way of sharing accessible time together. In my experience, families more often than not want to be involved and learn new ways to be with and support their loved one. And music, I think of perhaps all of the ways they could be getting involved, is a fun and engaging way to do that, whether we're talking about someone with a brain injury or a person living with dementia. Those are things that affect the whole family system.
Hi, Elizabeth. Welcome to the Carecast.
Thank you. Thanks for having me.
We would just say, I was just reading the name of your company and your surname, and I think you were born for this, quite frankly, your role as a music therapist. But for listeners new to the space, what is neurologic music therapy? And just tell us a bit about your background and what it is that your company does, if you would.
Sure. So maybe I'll just talk briefly about music therapy, which people may
Yes.
be more familiar with first. So, music therapy is primarily a psychological intervention. It's a recognized allied health profession, and central to how music therapists work really is the therapeutic relationship that is established between the therapist and the client through engagement in things like live musical interaction and play. And interventions in music therapy might include things like songwriting, it could be improvising, music listening, for example, to support in areas like self expression, mood, emotional well-being, etc. And some music therapists might also support other areas like movement and cognitive goals using music activities. And but neurologic music therapists are essentially music therapists who've undertaken additional specialist training. So, in the same way that professions like physiotherapy have specialisms like neurophysio, neurologic music therapists basically have additional kind of knowledge in how music impacts the brain and specifically in music based protocols that can be used to support either training or retraining areas of the brain to support speech and language, cognition, motor skills, and psychosocial functions. So it's a system of 20 techniques. And we always use kind of initial assessments and design therapy interventions with kind of real world applications. So let's say we had a patient referred to us who had an acquired brain injury and now had some difficulties with sequencing, which might make doing something as simple as making a cup of tea or getting dressed really challenging. If we were working within that NMT system, we might use a specific cognitive technique drawing really on the science of how music can build a new neural pathway. And we would translate some of the sequence steps into a song format to aid that retrieval and memory recall, because music memories are laid down different in our brains. And over time, the client can kind of internalize that song as a prompt to help them as needed. So another distinctive thing in NMT is we use the music as the supporting tool, and then we remove it as kind of gains become generalized to every day.
Amazing. I didn't realize that at all. What sort of patients do you work with? What typically conditions you mentioned? A brain injury, but what other sort of conditions might your patients have?
So that's a good question. I think one of the things we often refer to in neurologic music therapy is that it is a function based treatment, so not population specific. So for me personally, if I think about my caseload, I work with a lot of children with cerebral palsy as a result, perhaps of a birth injury. I also do a lot of work with adults with stroke and brain injury, our adults in a disorder of consciousness. But really, we could be working with a whole range of populations, depending on what the functional need is. Then we would really use that to inform how we might best support that person.
And any sort of degenerative conditions such as Alzheimer's or dementia?
Yeah, absolutely. I think a key thing probably to highlight that's helpful is in NMT, we would work across three kind of categories. So either developmental goals. So in the instance perhaps of a child where we're developing skills for the first time, we're either working kind of in rehabilitation, so kind of trying to restore function as best we can, or we're looking at kind of maintenance based goals. So that would be specifically for neurodegenerative conditions, things like dementia, MS, etc., where we may see some initial improvement, but we're also really looking at how can we maintain function for as long as possible.
What is it about music therapy, or music rather, that's so powerful for rewiring the brain after a brain injury? I'm going to make a wild guess here. I'm guessing it's got something to do with evolutionary importance of music and how music probably has been around for hundreds of thousands of years in the human experience, but I don't know. Is that anything to do with it?
Well, there's certainly, that's a whole other podcast we could do about kind of the cultural evolution of the role of music and what that plays. But certainly, if we're thinking specifically about, rewiring the brain after an injury, the great thing that we know about music now is that it activates every area of the brain. And the implications for that are numerous when it comes to something like neurorehabilitation. Some things that we could highlight specifically would be, the brain has this natural tendency to synchronize to a beat. So that's a process we would refer to as entrainment. So stroke patients, for example, can retrain walking patterns by moving to a steady rhythm, because the auditory system essentially acts as like an external pacemaker for some of those damaged motor circuits. So we might look at some gait training in neurologic music therapy. Another thing music can do is activate kind of neighboring or parallel areas to take over function where there is damage to a particular brain injury. So brain region, sorry. For example, a stroke patient that maybe has left-sided damage, maybe expressive aphasia. Again, we might use singing, which kind of preferentially activates that right side to help kind of retrain speech, recruiting that kind of right hemisphere to help us kind of create an alternative speech pathway. And music also kind of triggers that dopamine release. It activates our limbic system. And that's why, perhaps people with Alzheimer's can sometimes still sing a song even when they have difficulty maybe recognizing family members, because emotional memory, that emotional musical memory, is encoded differently and is often kind of more resilient to damage. And then, of course, the motivational piece with music, which sounds really simple, but, recovery requires lots of repetition. And, repetition can become boring. It can become exhausting, and kind of music can make necessary repetition feel rewarding. So it's not just that music is neurologically powerful, it keeps people engaged enough to actually kind of do their rehab, which is essential.
And to what extent do you choose a music style that might actually reflect that person's age or their cultural memory, so to speak? Does it tend to work better if someone was a teenager in the 60s and you choose that era of music?
Yeah, absolutely. So selecting music that is personally meaningful for that client is essential. It also depends on what we're working on. So if we were working on gait training or relearning to walk, where we're really thinking about that mechanism of rhythmic entrainment, in that instance, it's really about providing the rhythm that's important. So we might not necessarily in that instance be using familiar music, but if we were trying to, say, trigger automatic speech for somebody with aphasia, working with music that's meaningful to them, that's really well encoded, that can sort of trigger some of that. If we're doing some singing and then we leave off a word, it's so well encoded, but that's also motivating for them to engage in that sort of exercise from the very beginning. And of course, more broadly, if we're supporting things like psychological adjustment, then thinking about the role of their own identity with music and the role that can play, it's key that we know what is meaningful for that individual. So absolutely, as much as we can integrate and make our interventions as person-centered and tailored as possible, then we will.
Amazing. Can you share any sort of real world examples of where someone has been able to regain a function or an ability that they may have lost. And with the therapy that you provided, it's really helped them get it back.
Yeah. So, in my career, I've been fortunate to have an opportunity to work with people across different stages of the rehab pathway. And when I've been working with stroke patients, say with aphasia at the subacute stage, so let's say that's a few weeks after their stroke, I've often used certain music based techniques within NMT to support them maybe to speak for the first time. And this may only be a simple phrase, it might just be their name. But, it's really humbling and moving to see kind of the profound impact that can have on someone to hear themselves again after their stroke for the first time. And I've had, you know, quite powerful experiences of that. I had one client where she had sustained a traumatic brain injury. And at the point I was referred to see her, she was discharged, she was at home. This is 4 years post injury at this point. No speech and language therapy input because, she hadn't spoken at all in 4 years. So it wasn't deemed that would be adding value for her. And through kind of using different ways into the brain, kind of activating different networks, we were able to kind of trigger some speech for her again. And, I remember her husband was in our sessions and he kind of came out to me afterwards and he sort of had tears in his eyes and said, I never thought I would get to hear my wife's voice again. So it was very emotional for her to hear herself, but also for him. And whilst these were really small inroads that we'd made, we were then able to build, even in a small way on that. It was still significant from what she had previously. And that was just because of what music was able to kind of ignite, which was really just amazing to see.
And obviously, we've looked at, say, injuries to the brain and neurodegenerative conditions. Obviously, these days, with a lot of children probably spending too much time online and various other potential environmental factors, starting to experience ADHD and things like that. Have you worked with clients with ADHD and other similar conditions that might be, that are outside of what we've already discussed?
So I haven't currently kind of worked with children with ADHD, but I do have colleagues who've worked in that area where it might be that they're struggling, to attend and engage in the classroom. And actually, a lot of what the input has been from their neurologic music therapist has been using certain techniques in NMT that look to kind of train different attention functions, but in a way that's really engaging, but that also has translatable applications. So, if we identify that actually, when that individual is highly motivated and engaged, then we don't really see any issues with attending and engaging. Okay, well, what could be generalized back into the classroom then to support them? And what strategies could we equip the teachers or parents to support that student to kind of remain engaged with their learning? So there are sort of different things we can think about in that respect. But I would say outside of kind of stroke, if I think about some of my children with cerebral palsy, for example, sometimes we're, developing different sort of physical skills. So we're trying to motivate and engage them to move their body in different ways. Again, like this can be uncomfortable, it can be painful, it can be frustrating for them. But if we can find, engaging ways to motivate them where perhaps we're thinking about an arm extension, but they're just thinking about trying to reach that symbol, then we're finding these creative ways of directing their attention into a really engaging activity, but it is ultimately working towards kind of physical function.
For the most part, it must be best to deliver your therapy in the real world, face to face, in person. But I presume sometimes you're doing it online with clients, especially if travel was an issue. But then sometimes in the home and sometimes in clinics or maybe even in hospitals. But what's the best environment to work in, and what options are there? How can you work?
Well, I think there are therapists that work in a multitude of ways. Obviously, I would advocate for in person where that is possible, but I do also have online clients in my practice. That is often initially due to geography, but I have had some clients where actually, as part of transitioning from that intensity of being face to face, or maybe equipping them with more autonomy and agency, we've kind of looked at transitioning to doing online and then accessing maybe digital resources as part of taking kind of more ownership in their rehab. So sometimes online can also kind of provide an interesting pathway as part of kind of discharge. But it also kind of overcomes a lot of those geographical barriers. I would say, as part of any kind of screening, when we get a referral, we will kind of work closely with a family to determine at the beginning, is an online assessment even possible or appropriate? And for many clients, that may not be the case. It would depend what we were wanting to look at specifically and what level of support they would need from family or carers, etc. Whereas if they are able to join independently, etc., and perhaps we're working on some really targeted communication areas where they don't need access to any instruments, we're providing all of the musical input, then, online could be a great option. So it really just depends on a variety of factors, really.
We often hear about music unlocking memories. What's actually happening in the brain when someone, say, with dementia suddenly responds to a familiar song?
Yeah, so most of the memory systems that dementia impacts kind of earlier, like things like the hippocampus, for example, handle things like episodic memories, so kind of what you did, where you were, who you spoke to, etc. But familiar music, and especially songs that were emotionally significant during your teens and 20s, or what's sometimes referred to as their kind of reminiscence bump, kind of get encoded across multiple brain systems simultaneously, including those areas that are more resilient. So things like the basal ganglia, which kind of stores rhythmic and procedural memory of music. Things like the cerebellum, which handle kind of timing and motor patterns tied to music. Also areas like the medial prefrontal cortex, which is notably preserved for longer in Alzheimer's, which kind of links music to autobiographical emotion and kind of personal identity. And then the amygdala, which kind of holds that emotional charge that might be attached to a piece of music. So when somebody with Alzheimer's hears a familiar piece of music, for example, it's essentially lighting up a whole network of areas that the dementia maybe hasn't reached yet. So that's what we're seeing.
How important is it to involve family members and carers in therapy sessions, would you say, Elizabeth?
Oh, it's everything. It's hugely important. I think it offers families a meaningful way of sharing accessible time together. I mean, in my experience, families more often than not want to be involved and learn new ways to be with and support their loved one. And music, I think of perhaps all of the ways they could be getting involved, is a fun and engaging way to do that, whether we're talking about someone with a brain injury or a person living with dementia. Those are things that affect the whole family system. If we think about what I referenced earlier about, repetition being key for supporting perhaps cognitive change, I might only be there once a week. So a family that is motivated to support that individual to access maybe digital videos for independent practice, maybe to use those music-based strategies to support shared interaction and family time, or just to implement approaches that enable that person to participate as much as possible, are really essential for kind of optimizing how they engage.
So interesting. And for families that maybe don't have the budget for neurologic music therapy, or just wanted to maybe experiment with music themselves, what sort of simple techniques like maybe rhythm or singing or familiar playlists might listeners just experiment with when looking after a loved one at home, potentially someone with dementia?
So I think a key thing would be to think about, what is the focus on? Is it about facilitating self-expression? Is it about trying to activate speech? That would kind of guide those recommendations. But I would say if it might be around, say, supporting kind of mood, or if they are somebody that can become agitated, perhaps during even periods of personal care, for example. I've seen this in some of our care teams working with individuals with dementia, where perhaps they become quite distressed when receiving personal care. What we can look to do is maybe establish some specific songs or music that we consistently use as a team, based again on kind of knowledge of their musical autobiography, which we can work with family to establish. And we can look at using that music consistently during that period. So, for somebody with dementia, that consistency in auditory association can be really valuable for helping them anticipate and prepare. If we're using that with a child with a brain injury, it forms a type of sensory timetable for them. And particularly if you're thinking about different caregivers working slightly differently or coming in and out of someone's home environment, then having something structured that's consistent across that routine every time can be really powerful. So people often will think about using music for mood, and yes, that's absolutely something, but there are these other practical areas around transitions, around personal care, where music can also play a really valuable role for really supporting that person, not only to make that association with what's about to happen, but to really help them relax as well. I think
Kind of like
about,
when you're watching TV and the theme tune comes on or whatever, and then you're ready for what comes next, aren't you?
yeah, absolutely. That's exactly it. So, supporting that kind of association over time. And I've seen that firsthand with clients with dementia who, when they may see me in the hallway, they might not recognize me, but when I sing to them a song that we're regularly been singing in our sessions, they recognize me straight away, because they built that association with me with that piece of music. So I have myself have these firsthand experiences of seeing that in practice. But I think, if it comes to supporting maybe motivation or mood, again, thinking about creating maybe some mood playlists with your loved one, spending some time listening to music, identifying whether that makes them feel relaxed, maybe if it makes them feel happy, and curating some playlists that you can then play to them at different times to support them. I've had some clients over the years where they've actually really benefited even from having dedicated periods of music listening timetabled for them. Sometimes that has been because the care team have found it helpful to ensure that exposure is safe and not overstimulating. Let's not leave the radio on all day for the person with dementia. Let's be mindful about how do we replicate how they might have enjoyed music at home, maybe a period listening to a particular bit of the radio, doing the washing up, or now they're listening to some music getting ready, but you don't have it on all day. So sometimes it's giving that structure as a prompt for care teams to think about that kind of safe exposure and not overstimulating the client. And sometimes I've had maybe some of my brain injury clients where they've really struggled with initiating strategies. So they found it helpful to just look at their timetable and say, oh, I've taken that medication, which can affect me for the first couple of hours. I'm going to have my period listening to music at that time every day. So there's lots of different ways that we can kind of support families to identify how they might use music. Obviously, that's a few general ideas, but we would really work kind of collaboratively with families if they wanted to kind of understand more how to support people at home.
Now, you're obviously incredibly passionate about neurologic music therapy, and you've seen it work, and you know why it works as well. And I expect you'd love to see it become more widespread in therapy and rehab pathways across the UK. But how would you achieve that, do you think? How are we going to spread the word?
Well, we are small but mighty in number in the UK. So we are kind of growing. And, I've been fortunate over the last 13 years to be involved in setting up a number of kind of NMT pilots in the NHS, which are these kind of small steps towards kind of building more collective awareness and trying to build that UK research base. I think I'm confident as well, the more that we're learning in auditory music neuroscience, and more that we understand about how music impacts the brain and how we can all be harnessing that. I'm hoping that will make meaningful steps forward. I think about occupational therapy. I take a lot of inspiration from them as a profession. They're still sometimes misunderstood and certainly often underestimated in the scope of their contribution in terms of rehab, but they've made massive strides in education and advocacy and in embedding themselves as that kind of core, essential part of the MDT. But, 25, 30 years ago, that wasn't the case.
Yep.
So I'm hopeful that in a shorter time period than that, we may see kind of NMT kind of taken to more of a core component, because I think one thing that we really have as an advantage is that we cross over with kind of multiple disciplines. We do support with some of the psychological support. We can support with speech areas. We can support with kind of cognition, fine motor, gross motor, and, sometimes being able to reinforce, complement, accelerate goals that the rest of the team is working on. So I would hope that in time we might see it kind of sit at the heart. But let's see what happens. That'd be my hope. I hope I can retire and know that someone can graduate. I said to someone the other day, I hope at some point someone graduates, walks into a job and has no idea the hard work it's taken for that to become a normal opportunity.
Yeah.
But what a wonderful thing to be contributing towards. Definitely, for a lot of us that are doing this work, it's very meaningful to feel you're contributing towards kind of future generations of rehab and what that might look like.
I agree. What's one moment in your work, Elizabeth, that's truly captured the power of music in rehab and rehabilitation?
Oh, that's a big question. I think something that comes to mind is of a young man who was in a prolonged disorder of consciousness following a severe traumatic brain injury. And he had a high level of physical impairment kind of following, and also visual challenges post-injury. And he was diagnosed as being in a vegetative state by his treating team. And I had the fortunate opportunity to begin working with this man as an external therapist. And I was asked to carry out a MATADOC assessment, which is kind of the music therapy assessment tool for awareness in disorders of consciousness, which is a music-based behavioral assessment that can be used to assess awareness. It can support treatment planning and diagnosis for adults in disorders of consciousness. And the reason that can often be really helpful is because the auditory domain, particularly in individuals with limited kind of physical output, as in this instance, the auditory domain is the most sensitive for detecting awareness. And music kind of soon revealed kind of greater rehab potential than had been initially seen. And a year later, he's no longer kind of assumed to be in a vegetative state, but has now been re-diagnosed as being minimally conscious, which means he has inconsistent periods of being aware of himself and his environment, which may sound really small, but for his family, that's been massive. And it's been really exciting to see how using familiar music has supported him to engage in things like visual tracking, so kind of following things with his eyes, localizing to sound, so moving his head to follow where the music is coming from, kind of directing his gaze and following simple commands, and even just very recently vocalizing and interacting during moments where he's kind of highly aroused. And rates of misdiagnosis for disorders of consciousness is still as high as like 30 to 40%, which can have real implications if we think about, prognosis, therapy intensity, lifetime care costs. So music gave him that best opportunity to respond and to show what was possible, which I just think is amazing.
That truly is. How can listeners or referral partners or case managers get in touch with you at Nightingale NMT? Elizabeth?
So you can find us on LinkedIn, and you can find us on Instagram, or you can contact us through the website, which is www.nightingalenmt.co.uk.
Well, look, thanks. Lovely to have met you. Elizabeth, thank you for your time. To our listeners and watchers, thanks for listening and watching. If you found the video helpful, please give it a thumbs up and subscribe to our channel for more interesting discussions in and around care. Thank you, Elizabeth.
Thank you.